So fresh on the back of a rise in COVID cases and fears of a fourth wave, now news of a highly mutated variant of the virus. First case found in Botswana, but of course it's also been picked up in South Africa. It's hit headlines worldwide and of course today at home with that briefing from the Health Minister. Our numbers as well starting to climb. In the latest 24-hour period, 2,465 new COVID-19 cases and a positivity rate of 6.5%. That's sharply up. Tragically, 114 COVID-related deaths in this period. But it's still not clear just how dangerous this new B.1.1.529 variant is and to what extent it has already spread. Let's discuss this now with Wits University vaccinology Professor Shabir Madhi. Professor, thank you so much for joining us. So the Health Department this morning saying it's concerned because this variant has 32 mutations, it might be highly transmissible, it might be able to evade antibodies. But do we have any proof as yet on whether this particular new variant is causing that uptick in cases, particularly that we've seen over the past week in Tshwane?
Good evening, Sally. So the short answer is that it's because it's temporarily associated, it's very likely that the variant is contributing to the uptick that we're observing. But at the same time, independent of the variant, based on what we had experienced with past waves in South Africa, we were predicting that we would start experiencing a resurgence around about December, January. It's come a few weeks earlier in Gauteng and probably will follow very soon in other provinces. So the resurgence that we're experiencing.
Professor Madhi, sorry, we lost you just for a second. Professor, I think it's the storm. We lost you just for a second, but you mentioned the two factors, and you started on the sentence, the resurgence that we're experiencing. If you could just complete that.
Yeah, so I think the resurgence we're experiencing is both because of the evolution of the virus, the new variant is circulating, but there's also other factors at play, including waning.
All right, Professor, I've lost you again. I'm going to move on because what I'm hearing is you saying it could likely be a combination. You say it's very likely this new variant is contributing to those cases, but also we did expect the fourth wave about now. Prof, you're back with me, I think. So I'm going to move on to my next question because I have a number. I've been reading quite a few articles. Some scientists have been quoted as calling the mutations horrific, potentially worse than Delta, but also saying that the high number of mutations might actually make this variant quite unstable and possibly less robust and transmissible. What are your thoughts?
Absolutely. So it's difficult to predict exactly how the variant is going to pan out. There's another variant that was identified in South Africa around about July, August. It was known as the C.1.2 variant. And many people were excited about that variant because it was sort of a combination of the Beta variant and the Delta variant. And we thought that was the worst case scenario. But that variant very much fizzled out. So it's still early to tell as to what exactly is going to happen with this variant. I think what's important to appreciate is that much of the sort of noise around this variant currently is about how the activity of antibody might be affected by these mutations. But what we understand in terms of immunity, especially against severe disease and death from COVID-19, from the virus, due to the virus, is that protection against severe disease and death is more dependent on another arm of the immune system, which is known as T-cell immunity. And it's much more difficult to sort of measure the T-cell immunity than antibody activity against the virus. And the classical example, in fact, is South Africa, where with a Beta variant as an example, the AstraZeneca vaccine, because of the diminished antibody activity it induced against the Beta variant, didn't protect against mild COVID. But the single dose of the AstraZeneca vaccine in a study in Canada reduced the risk of severe disease due to the Beta variant by 80%, just a single dose. So we just need to be cautious how we interpret the data and to what extent we extrapolate from what are currently theoretical concerns. But the next few weeks or the next week or so will basically unmask the true significance of these mutations.
And you will correct me if I get this wrong, but there's antibody that we can monitor, and there's T cells. And the antibody, I think, kills the virus, and the T cells teach our healthy cells how to combat it, or the other way around.
Yeah, so the antibody functions in two ways. It sort of binds to the virus and prevents the virus from attaching to the cells, but it can also contribute to killing the virus. But in fact, the T-cell immunity is much more important, in that when the virus has gotten into the cell, which is where the virus needs to be able to replicate, those T cells then attack those cells that are infected and destroy the cell, and consequently the virus is unable to replicate.
Right.
So the T-cell responses, in fact, probably are more important when it comes to containing the ability of the virus to replicate in the body.
All right, so our hopes are on the T cells, even if it seems to neutralize the antibodies. The mutations are mostly, from what I've read, on the spike protein, and that is where most vaccines work to prime the immune system against the virus. And that's according to a Guardian article I've read. And it sounds from reading that this variant has evolved almost just to beat the vaccine. Is your answer again going to be that we hope not, and we hope that the T cells will actually be more beneficial?
Correct. So with AstraZeneca vaccine as an example, the T-cell responses are targeted to more than 80 different parts of the spike protein, more than 80 different parts. And with a beta variant, only about a handful of those parts were actually affected because of the mutations for the beta variant. So there might be a few more sites that are actually affected when it comes to the T-cell responses that are induced by vaccines, but we're still going to get reasonable preservation of other parts of the T-cell immune response, even for vaccines that are only using the spike protein. So I am concerned, but at the same time, I think our concern will be misplaced if we start believing that vaccines are not going to protect against severe disease and death. It might well be, unfortunately, that vaccines will be less effective when it comes to protecting against infection and mild COVID due to this particular variant. But for severe disease and death, I think we still got some level of security that vaccines are probably going to maintain the high level of effectiveness.
Wits vaccinology Professor Shabir Madhi, so he thinks it's very...
Yeah, it's very important what he's saying, and he says we should not lose hope about the vaccine. So, yeah.